Hey guys, my name is Dr. David Song. Welcome back to my channel. Today we'll be looking at butt winking and why it might be happening in the squat. So there's a lot of reasons why you might be butt winking. And butt winking basically is a phenomenon where your pelvis starts to go into posterior tilt early, causing flexion of the lower back as well. And this can occur before your squat reaches depth, which is when your thighs, basically the bone, the shaft of your femur, reaches parallel with the ground. So we're going to take a look at some of the causes that might be happening here and figure out what we can do to address it, to figure out how we could get this to stop happening, get you lifting stronger, healthier, and better. So I forgot to mention, and this kind of goes without saying, that someone might actually be butt winking just because they don't know how to do a squat yet. If they still have issues after you coach them through the squat, you can run them through this gamut of tests to figure out what the root cause of their butt winking is. The first thing that we're going to cover today is the anatomical limitations. Basically, we're going to go over why it might be limited due to the shape of your acetabulum and the shape of your femur and where you're placing those two bones in that joint when you do your squat. The next thing we're going to go over is tight muscles that might be leading to changes in your movement function. And the last thing that we might be going over once those two subjects are covered is motor control. So this one tends to be the last thing that will be leading to a butt wink. If you cover the first two bases first, that usually does a trick, but if you do those two things and it still doesn't change anything, then it's likely a control issue. So butt winking, if you take a look at my side profile, occurs when you're doing a squat, and what ends up happening is you go into posterior tilt, causing flexion of the lower back. And this can happen with weights and without weights. Some people might be doing it more so when they're lifting heavier weights, whereas some other people might be getting it with just the bodyweight squats. When we're taking a look at the anatomy of your hip, it actually depends on how big the head of your femur is and the shaft of it, as well as your acetabular rim. The acetabular rim is that socket component of that joint that's actually attached to your pelvis, and that femur sits inside of that socket. When you're taking a look at the squat, that femur needs to go into hip flexion, and eventually it'll run into the anatomical limitation where that femur will then make contact with that acetabular rim. Depending on the shape of your sockets and the way that they're located, you will have to change the width of your squat. Everyone will have a different squat width, and that's okay because everyone has different shaped hips. So it's very important that if you're a trainer, coach, or a therapist, that you're not prescribing everyone to just get their legs to shoulder distance width. You will actually need to assess this through McGill's test for squat width. The other thing that can be happening once you figure out how wide the squat is going to be is how much internal or external rotation is actually happening through that hip. If you were to actually think about the hip socket and the way that's shaped, which is a circular dome shape, the amount of internal rotation can lead to early contact versus external rotation, allowing that same amount of flexion to have space. Even though you have the feet placed outwards, they might still have a functional valgus, which causes internal rotation of the thigh even though the feet are facing out. The number one reason why I see this happen actually has to do with your squat stance and the width that you're going to be taking. Two things take place when you take a stance. One is how wide your feet are. The second thing is how much rotation you're actually getting through the legs. If you take a look here and you start to squat and you notice that you are doing some butt winking, one of the things is that you can be in a more narrow stance. And with this, what ends up happening is this femur right here, my thigh, will hit the rim of my acetabulum early. When it makes contact with that acetabulum, it will continue to push this pelvis into posterior tilt. And that's more of a structural anatomical limitation. It has nothing to do with function. The second thing that might be happening, let's say if you have a wider stance, is that you could have lots of internal rotation. Now if you take a look at me going to internal rotation of the thigh, this will again cause almost like a pseudo narrow stance. So even though your feet are squatting wide, your hips might be squatting narrow. Some things might be apparent with that, which is you might see some knock knees with that. You might see just rotation of the leg happening when you're observing what the person's thigh is doing. You really need to pay attention to that person's thigh angle in order to really determine if this is actually related to their butt winking. So like I said, this is particular in those, you might see some butt winking in deadlifts as well. It's particularly in those who take a sumo stance, they might be butt winking because in that wider stance, even though they're wide, they'll be internally rotating the thigh ever so slightly, which will cause the butt to wink. With butt winking, it's not too uncommon to feel pinching at the front of your hip. That can happen, again, depending on the hip angle and the hip rotation angle. So a quick test that you can do in order to determine how wide you should actually squat is McGill's quadruped squat test. So you're going to go on your hands and knees, and you're actually going to rock back on your hips to see how far you should go. So if you take a look at my stance right here, in a more narrow stance, if I push my butt downwards towards my heels, you'll start to notice that eventually I will run out of anatomy and my back will start to curl. In order to determine how wide you should actually be squatting, you'll just keep slowly and progressively widening up your knee width in order to see how far you can get without curling that low back. What we're really trying to do is mimic a squat by going onto our hands and knees. We want to really see if we can get into that squat depth without curling, without any butt winking. If you really think about it, you should be able to eventually find a width that can actually get your butt to squat way past depth while still maintaining a neutral spine and going as deep as you can. So for me, it's about here. I could go rock back all the way down without actually curling my spine. And if I just simply stand up and I do that same thing, I can actually get that low without my butt winking at all. So not saying that you need to necessarily squat that low, it's just a great test that you can do to really figure out how wide you should be standing. Contrary to popular belief, it's actually okay to have your feet not pointed straight forward when you're doing your squat. It actually might be harmful for you depending on the shape of your anatomy, depending on the shape of your hip socket and the shape of your femur. What I suggest doing is playing around with rotating that thigh and foot outwards. And you have a range of 0 to 30 degrees of external rotation to play with. So find out what angle works best with you. If you end up having a knock knees problem, not sure why it's happening, and this can be the reason why you're actually getting butt winking, you can take a look at my other video that goes over all the different mechanics of why knee valgus might be happening. If you figure out that problem, then you'll inherently figure out the butt winking problem, which is why I decided to make this video after the knock knees video. Let's say you figured out how wide you should actually be squatting based on that McGill test, and you figure out, hey, this is how wide my knees should be or legs should be when I squat. I could get there without my low back curling. But you stand up, you do the same width, and you still end up butt winking. Why is this happening? That then becomes a functional problem. There are a few reasons for that. One of the number one things that I tend to see is that someone might be gripping down with their hip flexors, namely the iliopsoas muscle. The iliopsoas muscle actually starts from your lumbar spine all the way from L1 down to L5, goes through the body, through the pelvic bowl, into the front of your thigh. And this muscle is mostly responsible for hip flexion or raising the knee up when you're in a standing position. However, when your feet are planted and you can't raise both thighs up and you go into a squat, instead of pulling your knees up, it will pull your spine down towards it. When you're taking a look at me doing a squat right now and you have a tight hip flexor, what ends up happening is that that muscle, because it's short, will pull your lumbar spine towards it. And this is more of a functional issue when you start squatting. So as you start to go down, that hip flexor will tighten up and cause some flexion of your lumbar spine as you go into hip flexion. Having a tight hip flexor is actually one of the reasons why when you do something like sit-ups, you can feel it in the low back instead of in the abs. It's because you're recruiting the hip flexors to do the work of lumbar flexion. So one of the things that you can do to start working on this problem is you can see a massage therapist to work on that tissue. Physiotherapists or a chiropractor as well will also work on these tissues. And after that, if you got that work done and it was truly due to a tight hip flexor, if you go back into doing your squat, you should have no problem doing that squat without any butt winking. But let's say that you don't have access to someone that can massage it out and it's kind of hard to find on yourself. You can actually use a kettlebell to help you massage out that muscle. The best way to start working on this is actually having that kettlebell on the floor here, and you're going to be lying down on it, face down. I like to angle it parallel to where the muscle will go. So that muscle will go again from that lumbar spine, which starts once your ribs end, going into the front of the hip. From here, you're going to just gently place that kettlebell on that muscle and lean into it. You're going to just sit there for about 30 seconds. You're not going to spend a ton of time, and just try to breathe into it so that the muscle can relax, and then you'll retest the squat right after. If you're wondering where to actually place this kettlebell, it will actually be right to the outside of where your rectus abdominis muscle will end. So you'll have that six-pack muscle coming along down here. If you flex your abs, you should feel it. The iliopsoas will be just lateral to that, kind of in this region right here. If you actually were to segment your abdominal wall into 4 parts, one going down the middle and one down the side, it'll be somewhere along the midway through. And if you put pressure there with the kettlebell, you should be able to reach that muscle. You can also reach that muscle at its distal insertion at the front of the thigh. In that case, you could also place the kettlebell there. So we'll actually take that kettlebell and we'll go from it running vertical to your body to horizontal to your body. And you're just going to place it at that inner upper portion of that thigh near the pubic region. So you're going to lie down on your side, and I like to just roll onto it just like that. You can hold the kettlebell to provide a little bit more stabilization, and you just hold this for about 30 seconds. You don't want to spend a ton of time beating up this muscle. You just want to get it to relax. So now that you massaged up the muscle, you should be able to go back into that squat and do it without butt winking at all. The next thing that can actually be causing you to do some butt winking is the lack of neuromuscular control. Fundamentally, what you would have a problem with in this type of scenario is eccentric contraction of the iliopsoas muscle during the squat. If you think about the same iliopsoas muscle pulling the low back into flexion, that muscle is contracting concentrically. It's causing an actual movement. Whereas what you actually want it to do is eccentrically contract so that it's actually lengthening so that it can hold a neutral spine while still providing the contraction required for spinal stability. One of the exercises you can do just requires a stability ball. You're actually going to take a stability ball and place it underneath your bum and take a squat stance. From this position, while you're sitting on it, you're actually going to use the opposite muscles in a squat to push your body down onto that ball as hard as possible. So what you're essentially doing is you're getting that hip flexor, turning it on to push you deeper into hip flexion. So I'm trying to compress it with my own body strength on top of what gravity is helping me do. If you take a look at my side profile, again, I'm just going to go into my squat stance as if I'm about to do a squat, and I'm pulling myself into a deeper squat as hard as I can. And this should be a pretty high effort exercise to push myself into a deeper squat. What this will do is change the way you're signaling your muscles to activate. Following this exercise, if you do about 3 to 5 reps of 20 to 30 second holds and you try to contract those muscles as hard as possible, if you get up and do your squat, you should be able to do a regular squat without butt winking. Now sometimes you might be doing a butt wink because you have a really tight abdominal wall. I know if you do tiny sit-ups, this muscle can be actually quite tight. Doing a similar setup as a psoas self-release will be helpful. In this situation, when you got the kettlebell, instead of placing it here kind of in the middle of the left quadrant there, you're actually just going to place it right on the muscle belly of your rectus abdominis. So you're going to have that kettlebell placed horizontally to your body, and you're just going to lean into it gently with your elbows on the floor. And you're just going to pick a few points here. You're not going to do the whole muscle belly, and you're also going to just do this for about 30 seconds or so until the muscle relaxes. And then after you've done both sides of your core, if you recheck your squat, you should be able to do a squat without any butt winking at all. Another problem that can end up happening is actually due to lack of core control. If you can imagine, as you're doing a butt winking, you're actually curling the spine, causing a flexion motion through that low back. Through here, your rectus abdominis and your other core muscles are actually going to be contracting into in a concentric contraction because it's trying to shorten to hold you up. If this is the case, then elongating the muscle and learning how to contract it from there to cause an eccentric contraction is going to go a long way. A really quick and easy way to start eccentrically contracting your abdominal muscles is actually having your hands up and you're going to lean back, holding it. Some of you might experience, if this is your issue, some shaking with your abdominal wall as you do it. what you do is you're going to raise your arms up and you're going to lean back as far as you can without actually falling down. Now, as you can watch, if you keep challenging the end ranges, you will notice some shaking. If not, you might be fine as you get more well developed at doing this. Now, sometimes this can be an issue with eccentrically contracting your obliques. In this case, changing the exercise to add a twist will load those muscles up a little bit more. What I mean by adding a twist is you're going to have your arms up in the air, and you're just going to lean back with one arm, twisting as the other one remains up. And then you can do both sides and come back up. So what we're doing now is we're actually stretching that abdominal wall out, but still contracting in an elongated position to hold our body up. Now, I like to do about 10 reps or so on both sides of this and then return back to the squat and see if this corrects the butt wink. Another muscle that might be tight that might be leading to your butt winking is actually the hamstrings and your glutes. If this happens to be the case, then massaging out the hamstrings or the glutes can be a way to resolve the butt winking. I like to use a massage ball or a lacrosse ball for targeting the hamstrings, just because I find that it can be a little awkward if you're using a foam roller. You're going to take that ball and you're going to place it on a few tight spots along the hamstring, and say about 3 spots on the inner and outer hamstring while you sit down on it with a straight leg. So we're going to take that ball, we're going to go sit down on the floor, and we're going to just place that ball right on that hamstring, and we're going to hold that for about 30 seconds. I like to start from the top and work my way down. So after I spend about 30 seconds on this point, I'm going to raise my leg up, place it a few inches below, and then repeat. And you'll do this again for the inner thigh. Really what we're doing is we're just giving this muscle another input, a pressure input, and this will cause a feedback loop to the brain, back to the muscle, to get that muscle to relax. So do not spend more than 30 seconds per each point. Really, the whole leg should take about 2 or 3 minutes. If you finish massaging out your hamstrings, you're just going to stand up and retest that squat and see if you're still butt winking. You would likely need to do both sides before you retest it, but sometimes you could it might just be due to one side being tight. If you want to actually massage out the glutes, you're going to take that same ball and you're going to target a few different points on the glute. I like to work my way from the inner to the outer glute and kind of work my way down. Again, I only pick about like 3 to 5 points here and spend about 30 seconds on each point. You're going to take that ball, you're going to place it on your glute, and I like to sit on it first. From here, you're going to take that other leg and you're going to place it on your knee just like that, and you're just going to hold it. After spending about 30 seconds here, you can roll onto a new point, and again, just compress and hold and try to relax. Now that you've finished rolling out your glutes, you can now recheck your squat to see if you're still butt winking. You might have to do both sides just like the hamstrings because you do have 2 limbs there, but sometimes you could just do the tighter side and that'll fix the problem. Now if you find that the massage ball is a little too intense for your hamstrings or your glutes, feel free to move on to using a foam roller. If you're just a little sensitive, that's fine. Everyone's different. I just personally prefer to use a lacrosse ball. I happen to be a little bit looser because of all the mobility work I tend to do on a daily basis. Now that we've ruled out a structural problem as tight muscles, we can actually look into the motor control problems. If it is due to a motor control problem in the hamstrings, what's happening is that you're not using it as an eccentric contractor as you go into depth for your squat. The best way to start working on that is doing some other exercise for a warm-up, like a good morning or a straight leg deadlift, to get those hamstrings fired up. So today we're going to go over doing a stiff leg deadlift to warm up those hamstrings before we do something like a squat for eccentric control of the hamstrings so you can hit depth without butt winking. For this exercise, you just take a kettlebell, you're going to hold it in both hands, and this can be any weight really. You're going to go stand with your feet roughly around hip distance apart, keep your back straight, and you're going to bend the knees only slightly as you lower the weight as far as you can. You're going to go as far as you can without actually curling your low back, and what this will do is encourage a deeper stretch through those hamstrings. Once you kind of reach the end range here, you're going to contract those hamstring muscles by driving your ankles into the floor and behind you to stand up. Try not to just use your back extensions to lift the weight up. You do want to drive the exercise through the hamstring muscles. I like to warm up with a set of 10 to 15 reps just to get those hamstrings going. and see how they are able to tolerate an eccentric contraction. The eccentric component of this exercise will occur as you are lowering down into the bottom of the stiff leg deadlift. So the eccentric contraction is actually occurring right now. My hamstrings are lengthening, yet they have to contract in order to prevent me from falling down forwards. Now I'm going to do a concentric contraction by pulling on those hamstrings to lift myself back up. Both components of this exercise are very important. For the eccentric phase, it's a great idea to spend about 4 or 5 seconds going down to the bottom, and then you can come back up in a 1 or 2 second tempo. Now that you've loaded up your hamstrings and you've taught your body how to load up eccentrically while still maintaining a neutral lumbar spine, you could retest the squat to see if that changes things and see if that stopped your butt winking. Next, we'll be talking about eccentrically contracting the glutes. Now technically, the stiff leg deadlift can be changed into a regular deadlift to hit up the gluteus maximus more. Well, right now we're going to go over the gluteus medius muscle, which is responsible for abduction of that hip. Since the glutes are actually hip abductors as well, we're actually going to modify a split stance deadlift so that we can recruit those hip abductors, your glutes, in extension and abduction at the same time. This will just maximize how much we're eccentrically contracting those muscles. Once again, you're just going to grab a weight like a kettlebell. This could be a dumbbell as well. And we're going to do this with one leg at a time. You're going to have one leg just slightly in front of the other in front of you, with most of your weight put onto that front leg. From here, you're going to bend that knee so that you can decrease how much tension is going through the posterior line there. From here, you're going to just drop the weight down, allowing your hip to shift outwards. When you're dropping this weight down, you're actually bending forwards as well, and you're going to try to maintain a neutral spine during this whole movement. Just like that. You should start feeling that eccentric stretch of that muscle. From here, you're going to stand back up, squeezing that muscle in the concentric phase. You could raise the same sided arm above your head to get a deeper motion through that hip by loading it and contracting it. Okay, so right now we're working on the eccentric phase of this muscle. It's holding me up, it's holding me together, and then concentrically to pull me back out of it. Now that we worked on eccentrically loosening the glutes, you should find that if you go back and return to your squat, the butt winking would have gone away if it was due to a glute eccentric contraction problem. Alright guys, that pretty much sums up all the different issues I tend to see when it comes to butt winking in the squat. Thanks for watching my video, everyone. If you like the content, hit subscribe, leave a like, and leave a comment if you have any questions. I'll answer them ASAP. Peace out, YouTube.